Good morning, everyone, and welcome to our Children's Legislative Agenda, preparing for the 88th legislative session. I'm Bob Sanborn from Children at Risk. And so on behalf of Children at Risk and the Texas Family Leadership Council, we're very excited to have you here. The couple little housekeeping notes on the slide for you to look at. But as we get going, here's the important thing for us to remember. When we start this legislative session, right, it does seem like all things are possible. And so this is a very optimistic time. And so as we go through the day today, we're going to examine all the options, all the possibilities as we frame ourselves and get ready for this next legislative session that could have a profound impact on children's and families' lives in the state of Texas. Every 2 years, the Texas legislature meets. Every 2 years, we work hard to pass lots of legislation that really help children. And this year is an extraordinary year because we're moving into a legislative session where there's going to be more funds, more money available for programs. And so we're going to see if we can really, as a state, put our money where our mouth is and make sure that we are prioritizing children and families for our state. So we'll see how this goes. But today you'll get a snapshot of where we're going with that. And so we hope you'll enjoy. We hope that you'll also ask questions, but we're going to try to do this very fast. Lots of people speaking for 8 minutes at a time. We're going to cap it off with a couple of good panels. I want to thank Amazon, who's one of our sponsors today, a very engaged sponsor. We're excited about them being a part of this. And I want to thank all the members of the Texas Family Leadership Council from all over the state of Texas who are represented today. We're so excited. If you're interested in being part of the Texas Family Leadership Council, let us know, because the more the merrier. The greater voice that we could speak with, representative of more people and more nonprofits across the state, the better it is for us to really accomplish great things for children and families in the state of Texas. Let's start with our first speaker. Many of you know Mandy Sheridan Kimball. She's the Vice President and Director of Public Policy and Government Affairs at Children at Risk. Mandy, are you having a good morning so far?
I'm having a great morning. Excited about today.
Yeah,
and
excellent.
just want to echo your thanks to people who are taking the time to hear about a children's legislative agenda, as well to the speakers today who have worked so hard to really get priorities together, to strategize, and of course find champions so that we can all advocate to improve the lives of children and families.
Excellent. Take it away, Mandy.
Great. So as Dr. Bob mentioned, we're going to be covering several issues today. I'm going to kick us off with two particular issues. We could go to the next slide, and that is going to be looking at opportunity youth in public education. So starting with public education, we know that 49% of Texas students are at risk of dropping out. Next slide, please. When we look at public education, I really want to hone in on chronic absenteeism, which is a red flag and indicator of a child leaving school and being disconnected. So chronic absenteeism is not just truancy, but it's children are chronically absent, not because they're just truant, but also because of health issues, homelessness, bullying, child abuse, lack of transportation, several reasons why children are not showing up at school. And we know that federally, the definition is a student considered chronically absent that misses 10% or more of the school days. But Texas does not have a state definition for chronic absenteeism. You can look at the Texas map here, and clearly you can see that Texas has a problem with chronic absenteeism. If you'll go to the next slide. When we look over time, you can see that this has been an issue for a while. And during the pandemic, we see that 15% of students are chronically absent. But even before the pandemic, we had an issue with over 12% of kids not showing up in school. And this is extremely important because when they're not in school, we know they're not learning. Next slide, please. When we look at populations of interest, we can see that pregnant students have the highest rates of being chronically absent, which is understandable. But we also look at economically disadvantaged students and special education students, where 20% of these students are chronically absent. And this is significant when we look at the student population and know that about 60% of the student population is economically disadvantaged. So there's a huge portion of children who are not attending school in a way that is meaningful and that they should. Next slide, please. When we look over time, you can see that during the pandemic, there was a significant drop in students who were pregnant during the pandemic, and that's probably due to virtual learning. And so there's ways that we have figured out to better engage certain populations. But what is also eye-opening is that when you look at the English language learners and the bilingual learners, historically, they had the lowest rates of chronic absenteeism, but during the pandemic, significantly increased. So we must look and see how we can better support this population. Next slide, please. There's some communities and education service centers that are doing a great job. When we look at El Paso and Edinburgh and Wichita Falls, Austin, all lower rates of chronic absenteeism. However, Corpus Christi, Midland, Beaumont, Amarillo all have significant chronic absenteeism issues. And so how can we best support these communities and make sure that the kids are participating? Next slide, please. When we look at race and ethnicity, Black students and Hispanic students historically have had higher rates of chronic absenteeism, around 20%. But during the pandemic here, there was a significant increase, and the pandemic had the greatest impact on Black students. So how can we lift all of our children and address this issue? Next slide. So for policy recommendations, this is really important because there are going to be a lot of education priorities that need to happen. Funding, of course, but we have got to wrap our hands and minds around chronic absenteeism. And the first step is to define chronic absenteeism for the state of Texas, which should be when a child misses 10% or more of instructional time. We also need to ensure that chronically absent students are under the at-risk category, because it's not just about definition, it's not about accountability, but what resources can we put in the school system to make sure that these kids are okay? How can we provide, again, more resources and tools to be able to bring those kids and give them what they need? And then we also need to ensure reporting and transparency so that strategies can be made. So there's going to be a lot of public education priorities. As I mentioned, chronic absenteeism is something we definitely like to work with you on. Next slide. Another indicator oftentimes for chronic absenteeism, or chronic absenteeism is an indicator for opportunity youth. Next slide, please. So opportunity youth is defined as young people between the ages of 16 to 24 years old that are disconnected from school and work. We have within that population of 16 to 24, nearly 14% of youth between 16 and 24 are disconnected and are considered opportunity youth. And although the majority of these youth live in urban areas, and rural areas have the highest rates of children being disconnected, and Black and Latino youth are disproportionately disconnected. Next slide, please. So to give you a little background, Children at Risk did an analysis amongst the 28 local workforce boards on how is the state of Texas prioritizing and strategizing to connect opportunity youth. And how it goes is that there are federal dollars, WIOA dollars, which are Workforce Innovation Opportunity Act, has dollars, and they go to the Texas Workforce Commission. The Texas Workforce Commission allocates these dollars to the 28 local workforce boards. Local workforce boards are tasked with creating a strategic plan and mostly looking at industry and employment needs, as well as in-need populations. But in our analysis, what we found was that only 20 out of the 28 local workforce boards were talking about this opportunity youth or the disconnected youth within their strategic plans. And when I say 20 out of 28, it just might be a mention, doesn't necessarily mean that there's a big strategy. So this is something that we've identified as a huge gap of something that we could focus on. Next slide, please. When we were looking at the local workforce board strategic plans, we saw that they were talking about certifications and credentials, apprenticeships, looking at how they can really work on upskilling and focusing on those goals. However, only half of those local workforce boards talked about how they were going to work with higher education, how they were going to work with the public schools. So what we're finding is that higher ed, local workforce boards, school districts are working in silos, everyone realizing that these children are missing and that there's a gap, but there's no strategy, there's not much of blending funds or really maximizing state dollars. Next slide, please. When we were also looking at the local workforce board, when we were looking at the local workforce board strategic plans, we saw that they were mentioning youth in foster care or aging out of foster care, which is great. This is strategically or statutorily required. So that's the 20 out of the 28 local workforce boards. We're talking about youth in the foster care system or aging out. However, 10 or fewer of these local workforce boards failed to mention anything about the youth who were in the involved in juvenile justice system or homelessness or in mental health. And so how can we have a comprehensive plan around these vulnerable youth to connect them? Next slide, please. And so policy recommendations, and this is something that we should all be working together, is to require every local workforce board to include opportunity youth in their strategic plans, making sure that there are strategies that we're maximizing dollars, that there's local coordination so that all children can succeed. We also want these plans to be posted and to ensure reporting. How are these millions of dollars being spent? And then that can help inform local efforts and strategies and future policies to ensure that these children are connected and that we have a vibrant Texas economy and a healthy population moving forward. So those are the two issues that I wanted to talk about today. There will be lots more covered. Thank you very much.
Mandy, before you go, I wanted to ask you a question. Obviously, a lot of what we're going to be talking about during the legislative session is related to sort of this recovery from the pandemic, right? The pandemic learning loss that we've seen in public education, the loss of kids going to pre-K, the increase in chronic absenteeism because of the pandemic. Is there a signature piece of legislation that you're sort of paying attention to that is all about sort of pandemic learning loss and how our state recovers from this? Because as we look at scores across our state, we certainly see that schools all across the spectrum have been adversely affected, right, by kids not being in school and by schools not being able to sort of deal with that.
Right. So at this moment, I don't think there's a silver bullet, right? But there are many issues like you mentioned. I mean, and we're about to hear from Kim that starts with early childhood education. We're looking at childcare and how do we build an early childhood education system? How do we get the dollars and supports in public schools? How do we get the mental health supports in schools that you'll be hearing about later? How do we address chronic absenteeism? How do we support the kids who are aging out of the foster care? Yes, but just the population of 16 to 24 that are disconnected. Kids experienced a lot during the pandemic. A lot of them were in high school and moving out and haven't really found their feet. They're resilient, a lot have, but there's a lot left to do.
It just seems like there's a lot to do there, right? And I know there's federal money that's been allocated to districts, and we, it's not all been used, but we hope that it's going to be used wisely. And so much to do. Thank you, Mandy, very much for all the work you do. And I know we'll see you later on in one of the panels. But let's go to Kim. Kim Coffran is the Senior Director of Education at Children at Risk. And Kim, obviously, the foundation for success with children sort of lies with early education. And, I always say it all the time, if there is a silver bullet for ending child poverty, it starts with early education. So give us an idea of what this legislative session will bring for us.
Thanks, Dr. Bob. And you're right. That early foundation, the brain development that happens in 0 to 5, we know that if we invest in our our young children from before they even get to our public school systems. That's where our biggest return investment is. So how do we get there, and where are we today? So go ahead and let's get started. So we know, go ahead, go to the next slide, thanks. We know that 1 in 5 children under the age of 6 with low income working parents live in a childcare desert. We lost about 21% of our providers from the beginning of the pandemic to September of 2021. Those deserts have continued to grow. Go ahead and go to the next slide. And so as we dig into what does that mean for our children and our families and our educators. So we know about 1/3 of our zip codes in Texas are now deserts. That's increased over from the beginning of the pandemic. We also know that our child care providers can't really charge families more. The recommendation is that about a family's income is about 7% of their income is used for childcare. And currently in Texas, for infants and toddlers, that can range anywhere from 10 to 50% of a family's income, which is just out of reach for most families. And so you've heard on the news, there's lots of good media happening on the stories of what's happening in our childcare industry. Families are just choosing for a parent to stay home from work. And therefore that's hurting our economy and hurting our businesses across Texas. What does that mean for the early child educators? We also know that our educators are still making poverty level wages. Even though our parents are paying more than what they can afford, that does not get trickled down to the educators because the margins of profitable margins in childcare are so slim. So we know that this market system doesn't work for childcare. So it has to come with a public investment. And we're going to get into this a little bit and what that public investment might look like. Go ahead and go to the next slide. So if we look at our deserts, we know we have about 1/3 of our zip codes are in deserts now. And when we think about what does that mean for children and families? There's about 55 seats per 100 children. So if you have 100 kids in a community, we know we can have capacity for about 55 of them. That leaves a huge chunk of us out. Go ahead and go to the next one. And as we look at the trend lines across the last 5 years, you can see that we were sitting pretty well in 2017 overall. And that dark brown line at the top is all childcare, all seats and available in Texas. And then the middle line is when we break down to subsidize, so our low income families. And then that bottom line is when we look at our quality programs that are within the subsidy program. So our Texas Rising Star 2 and 3, 4 level programs. So, we had this big dip from 2021, no surprise there with the pandemic. We're anxious to look at the data for 2022 as that's starting to get rolled in to see, did we dip more? Did we stay consistent? Did we edge up a little bit? But we also see this nice line going up with quality. So we know there's some movement going for quality, and we're looking forward to that to seeing where that trend line continues. Go ahead and go forward. So this money that came in, we had $5.9 billion of COVID relief dollars come into the state since the beginning of the pandemic. That was specifically for childcare providers. I'm not going to go into the weeds of where that is today. If you want to dig into that, join us for a Texas tour and we'll dig into what all those buckets were. But the big takeaway for today is that 74% of those funds went directly to childcare providers across the state. It's also important to know that those dollars went to all providers, not just providers that are taking subsidy, and that has really saved our childcare market. So even though we had this big dip from 20 to 21, this money has saved our programs and both homes and centers across the state from being even worse. The trick is as that money runs out over the next year, where that cliff is going to come, and what can we do at the state level to prevent that cliff from happening, or make sure that's a softer landing than what it is looking like it now. So let's dig in. Go ahead and next slide. So what are we asking for this next legislative session? We have 3 buckets, and I have 3 minutes left. So let's see if I can do this. The first bucket is to really help parents get back to work with affordable, high quality childcare and pre-K. How can we enhance partnerships between pre-K and in the ISD setting and childcare? That was part of HB 3 a couple sessions ago. We need to do some work to make that easier for both parties. So how can we make that better? Can we do property tax relief for childcare providers? We know that's something our governor and lieutenant governor are leading with our surplus. How can we make sure childcare providers are part of that conversation? How can you make accountability for workforce boards that give them some flexibilities to really meet the needs of their community and increase quality for families? We've got to support the early child workforce. If we don't have a workforce, we have no childcare, and if we have no childcare, we have no Texas economy. We have a bill, HB 619, that was passed last legislative session. Their report is due any day now on developing a strategic plan to invest in the workforce and develop a pipeline and support them with compensation and education. So we're anxious to see what that report finally says and if that can be moved into any legislative asks. We have to make that 2 to 4 year transition easier as educators go back to school and get their degrees in child development and education, and make sure those systems are streamlined and that transferability happens between the 2 and 4 year colleges. And the last slide. We have to invest in our childcare infrastructure. We have all the stabilization money that's hitting childcare providers now that will continue into May of into 2023. But when that ends, that's where that cliff is going to be. So how can we take this opportunity to really make sure that we are investing in this space, investing in this industry, knowing how it's the bedrock and it's the foundation for the rest of the economy. And then we have to make sure providers are getting what their true cost of care, and we need to make sure that we are giving them the highest reimbursement rates based on their quality rating, not what they can just afford to charge families. And I think that's it.
Hey, Kim, thank you so much. One quick question, and it's not an unusual question from me to you, but when we look across the state, we know that where we've seen high quality early education, and staff to provide that high quality early education and full day high quality pre-K, we've seen school districts take notable turns, positive turns, right? And notably, I would say the Rio Grande Valley and the El Paso area, where they've really concentrated on this quality early education. Does the state legislature, do we think that they get that idea that if we, that we're going to have to do more around the high quality pre-K, more around early education so that we can continue to have these positive turns? And do they understand that the pandemic just put us way behind in this?
Yeah, I think they do. Last session, which was in the middle of the pandemic, the legislature passed HB 2607 that made our Texas Rising Star program now mandatory for all programs that take subsidized children. So that's a commitment to quality. We want to make sure those, if we're putting tax dollars into those programs, we want to make sure that they're high quality. So I think the legislatures and our governing bodies are getting it. Do they know what it's going to take to get us to where we really need to go? I don't know. We're going to start having those conversations about real dollars this next session, and what that commitment really is going to look like. But their commitment is there to high quality. The efforts they've done with pre-K on the pre-K side, as well as the childcare side, are there. The foundation's there. We just have to continue to build and push them to really make it the system that we need it for children and families across the state.
I also think it's notable that both sides of the aisle in Texas, which is very unusual for many states, care about childcare, early education. We've been able to let everyone understand it is an economic development issue, right? And I think that's extraordinary. And thank you for the work, Kim, that you've done on that, and so many in the coalitions all across Texas that have been working on this, because so many other states like ours don't get this importance of early education. But we will see the benefits down the road, won't we?
We sure will. And it's one of the best bipartisan topics to talk about.
Yeah, very good. In a place where people don't talk much about bipartisanness. So
partisan, we have it here.
Thank you, Kim. Next up, I want to bring up our good friend, Dr. Claire Bikini, Baylor College of Medicine, Texas Children's Hospital, everyone's favorite pediatrician. And this is what's exceptional about Dr. Bikini, is that she's very engaged in policy, and the state legislature understands the ins and outs. So much around health that we're going to talk about, Claire. And are you feeling positive? Well, I'll let you talk and then I'll come back, but give us a little bit of an idea of what's going to be happening with health and children in the upcoming legislative session. Thanks for being here, Claire.
Sure. Oh my goodness, thank you for having me. This is a really nice session. If you all don't mind, I was going to share my screen. I think it's asking me to have you all stop sharing your screen first. Excellent. All right. And of course, I'm positive. I'm always very optimistic when it comes to these sessions. So I will go through what I think is going on. All right. So I'm super excited to talk about the physical health priorities for this legislative session. And I want to start by just reviewing our Texas Family Leadership Council health priorities. And we'll go into a little bit more detail. So one, protect and maintain current immunization policies that protect Texas children and communities. We're going to talk a bit about why this is so important, especially this year. We're also going to talk about the importance of improving maternal health in Texas, including expanding 12-month postpartum Medicaid health coverage, and also protecting and increasing funding for evidence-based primary prevention and care. And I also want to review Texas Pediatric Society's legislative priorities. Thank you, Clayton Travis from Texas Pediatric Society, who's on the call, who provided the beautiful versions of the Texas Pediatric Society priorities, which I'm a member of this amazing organization as well. So one, ensure all children and families have access to care. Maintain the viability of pediatric medical care, including improving Medicaid reimbursement rates, so more providers will actually be able to see more kids. Create safe and healthy environments for children to thrive, and protect our state's most vulnerable children. And those are our four big buckets, but I'm going to go into a little bit more detail now. Again, I think it's important to just kind of review these priorities, and then I'm going to spend my remaining time talking about, maybe three of them in a little bit more detail. So again, under the bucket of ensuring all children and families have access to care, one, we have the highest in the nation child uninsured rate. Consistently, we have the highest percentage and highest number of kids who are uninsured. This has to change. And I think being able to make sure that we enroll as many kids as possible, especially when we are having a favorable budget, is going to be really important. To me, it's an absolute no-brainer. We have to figure out a way to get extending postpartum Medicaid coverage for women at least 12 months to ensure our mothers are healthy and can care for newborns, and then have to continue to invest in pediatric mental health care. As a pediatrician, I can't tell you how many kids are suffering from, it's the highest number of kids we've seen with suicide attempts, and just severe mental health anxiety. And we really are not doing justice to the number of kids who need help and are really struggling with accessing help. And there are some very nice evidence-based ways, such as the Child Health Access through telemedicine and Child Psychiatry Access Network, of trying to get better care, more care, access to care to more kids. Maintain the viability of the primary care, pediatric or pediatrician, investing in the state's pediatric physician network. We really do need to have better reimbursement rates. Our state has not increased reimbursement rates significantly in a long time, and unfortunately that's leading to more providers, including more pediatricians, not accepting Medicaid, and that's a barrier for access to care for many kids. I also want to really focus on creating safe and healthy environments for children to thrive. This is where immunizations are important. We want to reduce nicotine addiction in Texas youth. The Texas Pediatric Society pediatricians in general are so supportive of common sense firearm safety policies to reduce child injuries and fatalities. We see this every day, unfortunately. And then, of course, with these mass school shootings, which are just absolutely heartbreaking. And then promote resilient families and communities by addressing non-medical factors. Some communities call the social determinants of health. Our state legislatures prefer non-medical factors that influence the health and well-being of children. And then protect our state's most vulnerable children. I think pediatricians are very closely monitoring and would like to protect medical necessity for children, including gender diverse youth. Invest in high-functioning child welfare system that prioritize child well-being, and of course, try to optimize funding for early childhood intervention, which helps a number of children with occupational therapy, physical therapy, speech therapy, therapies that they need to optimize their developmental outcomes. So that's a brief overview of our areas of interest. I want to just, again, focus very briefly on a couple things. One is improving access to care. We know being uninsured is bad for children. And again, we know Texas continues to have a high uninsured rate. I mean, the U.S. average is 5% of kids, overall 5% of kids. We're over double that. 10.6% of kids are uninsured. That's almost 800,000 children. And we know that leads to a lot of health problems. And we also know that Medicaid is an amazing program that allows me to see over half of my patients serves over 3 million low-income children and children with special healthcare needs, and 53% of Texas births. We know Medicaid is associated with a variety of good outcomes in kids, including helping kids, grow up to be healthier adults, earn higher wages, pay more in taxes, et cetera. So this is, hopefully, again, a nice way that we can partner with the business community to try to get more kids access to health insurance and therefore access to care. Again, we also need more Medicaid providers. This is a figure that shows you that every time we make a cut to Medicaid reimbursement rates, fewer physicians will see Medicaid patients. You increase reimbursement rates, you get an increase. Unfortunately, we really haven't substantially increased Medicaid payment rates in a long time, and therefore we're seeing shortage in Medicaid providers. Hopefully, with our budget situation, we can try to improve Medicaid reimbursement rates to other states and be able to have more Medicaid providers. I don't think I need to focus too much in this group about maternal mortality and how, in Texas, we're consistently well above the U.S. average in number of women who die within the first few months of pregnancy. And this is the most recent data looking at maternal morbidity released by the state, just showing huge disparities where we see non-Hispanic Black women having much higher risks of complications, morbidity from pregnancy, and also mortality. They didn't show all the figures, but this is just one looking at delivery hospitalizations involving severe maternal morbidity. There's been a lot in the news about this, knowing that a lot of maternal morbidity and mortality, over 80%, should be preventable. And that even though we're starting to see some more recent data, again, showing that Black mothers are more at risk of hemorrhages, which is a severe maternal mortality and morbidity risk, we haven't had our data. We're expecting a report in September of this past year, but we're still waiting for the state to release more data on that. But regardless, for years, the number one policy recommendation has been to extend postpartum Medicaid coverage from the 2 months that we currently have, or 60 days, to 12 months. We passed 6 months last legislative session. The federal government, denied that because they're requesting 12 months. And so hopefully, this next session, we can get everybody on the same page to extend to 12 months postpartum. It really is the right thing to do. And healthy moms equal healthy babies. The last thing I will say is very briefly is that immunizations absolutely save lives. I'm an infectious disease specialist. I see children suffer from vaccine preventable illness. And it's heartbreaking because these, again, are completely preventable infectious diseases that lead to, death and, brain damage, a lot of problems. Unfortunately, we have lower immunization rates compared to the U.S. and here in Texas, and we're seeing more and more people decide not to vaccinate their kids and getting exemptions, from the required vaccines for school. This is looking at the school year, and you can see the rates of number of people who have opted out of vaccines has been increasing. So much so that, these dark areas in Texas are areas where we have over 3% of the kids who don't have the all required vaccines, and that really increases our risk for outbreaks of vaccine preventable illness, such as measles, whooping cough, et cetera. So last main slide is that, this is a scary year because the anti-vaccine movement has really taken hold of Texas. The COVID pandemic, unfortunately, even though we had a vaccine that saved millions of lives across the United States and across the world, unfortunately, it spurred an anti-vaccine movement that now has really put together a package of anti-vaccine bills that have strong momentum in Texas. Now, no anti-vaccine bill passed last legislative session or during any of the little special sessions, but we know that there's going to be a focus on medical freedom and bodily autonomy, a protected class for the unvaccinated, which means that we can't have vaccine mandates because that's going to be considered discrimination. And if you're interested, the Baker Institute put together a fabulous policy brief reviewing the anti-vaccine bills that are coming up and how we can defend them. But I think, Bob, that was my whirlwind overview of some health-related things, and really looking forward to working together, looking forward to bringing lots of physicians and other healthcare providers to Texas, my family to Austin, to be able to do some advocacy work on these topics.
Claire, my go-to is always to talk about vaccines, but I wanted to ask you about something else. When we talk about early education, one of the things that's been important for us has been that we've had so much philanthropic support nationally, right? There have been lots of people that have been helping us. I wonder, I had a conversation yesterday and we talked about philanthropic support for Medicaid expansion. And what we found is that people were saying that any discussion people have had with national groups has been, unless Texas helps itself by taking all this federal money, why should we
Right.
help? And I feel like if you and I went up to Austin and we said everything but Medicaid, but all the things a part of Medicaid, people would say, oh yeah, we need more access. We need to reduce the number of insured. But the minute we say Medicaid, people are, like, oh no, we can't do that. Is there a chance? And maybe it's not this session, maybe it's the next one. Is there a way to reframe this so that people see that we shouldn't be turning away all these federal dollars to help children and families in Texas?
Well, I think you're asking the wrong person, because I don't, to me, it's a no-brainer, right? I mean, access to care is good. And we've seen other states, southern states, that are very conservative, accept Medicaid expansion and really have some pretty significant benefits from that. But in Texas, with our current leadership, there isn't, their ideology. I mean, they're opposed to this. I don't think we're going to really make any headway on that until we change some of our elected officials, unfortunately. But would love to see it happen.
It's interesting. Right after Uvalde, someone said we need to put more money into mental health, and someone mentioned to the governor, I heard them say, well, if we did Medicaid expansion, we'd have a lot more money for mental health. And it was quickly shut down, right? People don't want to talk about accepting federal dollars to help Texans in this case. So anyway, it's very tough.
We're paying money to the federal government. It'd be nice to get it back for our state. Yep.
Yeah, very good. Dr. Claire Bikini from Texas Children's Hospital in Houston. Thank you so very much. Claire, let's talk a little bit about human trafficking. We have Caroline Roberts, who's the senior staff attorney from Children at Risk, who's here with us. And Caroline, you doing okay today? You're on mute, Caroline. See, good that I caught you early.
Doing well, thank you. Sorry about that.
Very good. Well, I'm anxious to hear about this. Is something that a lot of people have interest in, and somewhere where Texas sort of really leads the nation in this area. So I'm excited to hear. Thank you, Caroline.
Thank you. Next slide, please. So there are just under 80,000 youth victims of sex trafficking in Texas. And back in 2018, Children at Risk mapped out suspected illicit massage businesses. So those illicit massage businesses that were listed on John forums, where there were reviews of these places and the illicit activity that was happening there, mapped those out, and then also mapped out public schools and found that 35,000 Texas children attended public school within 1,000 feet of one of these suspected illicit massage businesses. Next slide, please. So as I mentioned, just under 80,000 youth victims of sex trafficking as of 2016. That's one of the most recent and best estimates, but there are almost certainly more. And an estimated 15% victimization rate among those young people who have a history of emotional or sexual abuse, homelessness, running away, or involvement in the child welfare system. So our kids who are in foster care. This is important because I think that it's always important to think about where human trafficking intersects with these other issues, and that if we are preventing abuse, if we're preventing housing insecurity, if we're preventing children from falling into the child welfare system, we are also preventing human trafficking. Another just really important point that I want to make, 36% of victims are introduced to commercial sex by a family member or friend. So a close family friend or an actual family member. This is important because a lot of the depictions in the media have been, kind of the stranger waiting in the shadows, and it's just not, it doesn't match up with the data. And then 14% began by themselves. So in these cases, a lot of times it is survival sex is what it's referred to. But again, it's those kids who maybe they're aging out of foster care or they're homeless. They're facing, they need to figure out their basic needs, and so then engaging in exploitative commercial sex. So as I mentioned, we mapped out the illicit massage businesses in 2018 along with the schools. Since then, so from 2018 to July of 2022, the number of IMBs has nearly doubled from 689 to 1,325. Next. So these are a few of the policy priorities that we want to uplift, empowering and incentivizing local district and county attorneys to bring actions against alleged illicit massage businesses. So try to get that number down, allowing outcry evidence in all human trafficking prosecutions involving children. So those forensic interviews and those interviews with children when they're making that outcry, allowing that in as evidence, flagging driver's licenses for human trafficking. So this would, for those who are convicted of human trafficking, it would actually be something on their driver's license when they are stopped by a law enforcement officer and they pull up their license, they're able to see, hey, this person was convicted of human trafficking. And this is important because we have multiple cases of human traffickers transporting children across state and adults across state lines. Adding protections for victims of trafficking with significant disabilities, specifically adult victims. And then mandating the registration of all white label ATMs. These are privately owned ATMs that are present in a lot of the fronts for human trafficking. Requiring transportation network companies, these are your Ubers, your Lyfts, to train their drivers on human trafficking. And then screening for age eligible children in foster care. Because again, we know that we have this high victimization rate in foster care. And then finally, enhancing child pornography sentences and increasing penalties for traffickers that use excessive force, specifically strangulation. Next slide, please. So first I want to talk about this added protections for adult victims with significant disabilities. So these adults, oftentimes they are actually first victimized as children, but they are especially vulnerable to trafficking, and traffickers know this, especially those developmental and cognitive disabilities that affect their ability to assess safety or care for themselves. And this proposed change would remove the requirement that prosecutors prove force, fraud, or coercion. What looks like fraud for an adult with a severe intellectual disability is very different than our statutory and case law examples of fraud. So we actually this was brought to us by a prosecutor who was dealing with a case, and then we've had multiple prosecutors and law enforcement officers reach out to us with this issue. And it would just empower prosecutors and law enforcement to bring those traffickers to justice who are targeting the most vulnerable. Next slide, please. Increased penalties for traffickers that use strangulation. So 1 out of 6 sex trafficking victims reported being non-fatally strangled. This is also correlated with interpersonal relationship violence and interpersonal violence that ends in homicide. These victims are more likely to be in a close relationship, romantic relationship with their trafficker, experience other forms of relationship violence, and are much more likely to have been threatened with a weapon. So we believe that these sex traffickers, and in fact, the data bears out that these sex traffickers are especially dangerous and should be subjected to enhanced penalties. Next slide, please. Requiring transportation network companies to train their drivers in human trafficking. This was another one that was brought to us by law enforcement. So there have been multiple cases in which child victims have been transported by rideshare apps. And of course, this transportation is almost certainly happening unwittingly. It's not that we want to punish those drivers, it's that we want to get them on the side of fighting human trafficking, and they can work as first reporters. So for example, one child was transported at 3 a.m. on a Tuesday. That should be a red flag, but for a lot of these drivers, they might not know what they're seeing. So by requiring training and then also reporting information to be provided to the drivers, they will be able to better recognize the signs of human trafficking. Next slide, please. And then I'll speed through these last two, allowing local government attorneys to collect penalty fees against illicit massage businesses. Right now, local government attorneys are obtaining injunctions, but then the businesses just reopen, often under a slightly different name. It's been called the whack-a-mole effect. You whack one down, another one pops up. And as well, it's hard for local government attorneys to fund and have these divisions when they aren't getting any kind of money back. But if they were allowed to collect civil penalty fees and it was guaranteed that that money would go back to the locality in which it was prosecuted, they could collect $1,000 to $10,000 for every violation of Chapter 455, and they could better fund these divisions to shut IMBs down. it also does not rely on victim testimony, which is another important function of the last one. So registering all white label ATMs. This would allow us to identify those white label ATMs that are in the illicit massage businesses, strip clubs, illicit cantinas, and then actually use those in investigations. So if you're using it to prevent prostitution, that is money laundering, and it removes the kind of effect of we're arresting victims inside of these places and then trying to get them to testify, which we know is not often a very successful strategy. And it's also, more importantly, re-victimizing the victim. And it also would just permit the discovery of larger criminal networks by using this financial intelligence. So really excited about this one. Next slide. I think that might be it.
We'll assume that's it, right?
Okay.
I don't know if it's it or not. I wanted a quick question, Caroline, before we move on to the next session. You and I have been in lots of sessions with lots of legislators, federal and state. And I remember being with Ted Poe and John Cornyn, and both of them saying the important thing about ending trafficking is let's not politicize it, right? Let's make it a bipartisan issue. And we continue, Sinfronia Thompson, Joan Huffman working together, both sides of the aisle, really pushing this through in the state. But we're starting to hear a lot of disinformation about trafficking. And especially, you and I know that the most of the trafficking comes from American kids, foster care system, opportunity youth, right? But there's a lot of information saying, when we're having a lot of people, immigrants coming across the border, it's all human trafficking, when indeed you and I know it's not. How is that going to have an impact? This misinformation sort of tying trafficking to immigration. There are immigrants that are trafficked, right? But it's not the big problem that some people are making it out to be. How is that going to affect the state legislative session around trafficking?
That's a great question. And I will start by saying that the amount of misinformation and disinformation is very discouraging to not only advocates, but also survivors, because their stories are not being recognized in the news media, in even just conversations. And there isn't great data on this, but what we have anecdotally been seeing with immigration is more so that when someone comes over, it's not that they are being trafficked over the border. It is that when they come to Texas and they are, very, very vulnerable, they're not being housed, they're not having any kind of supports, that's when they become vulnerable, and then they're trafficked within the US. So we are the problem. The call is coming from inside the house. And I think, again, a better social support system would do so much to end trafficking. And that includes for recent immigrants as well.
Yeah. And I love the idea of what the problem is in the house, right? And the demand, the fact that it's men, demanding this. I mean, if men stopped asking for victims, then we would end trafficking. So, hey, Caroline, absolutely. A lot of work to be done. I think we'll have, again, great success, but thank you very much, Caroline Roberts, Senior Staff Attorney from Children. Thanks, Caroline, for all the work that you do. Let's go next to food insecurity. I thought we were going to do Jamie Olson next. Are we not doing Jamie? Okay, very good. Then we'll go to Sharon. Sharon Watkins is with us. Sharon Watkins Jones. She's the Chief Equity Officer from Children at Risk. And Sharon, I know that we have a robust need around equity in our state. Give us a little bit of an idea of what we're going to be facing.
Absolutely. So, and I know that growing up Texan can be so different for each of us, depending on where we live, how we got to Texas, and even the color of our skin. And that fighting for every child to have the opportunity to succeed is a moral imperative, but equally compelling is the argument that our state can't move forward with economic strength without making sure that all children are cared for and have an opportunity to succeed. Next slide, please. The reason for that compelling argument for our state's survival is that Texans of color accounted for 95% of the state's population growth from 2010 to 2020. Additionally, between 2017 and 2018, Texas school districts were 2.5 times more likely to suspend Black students in elementary school compared to white students, and often for the same infraction. What this says to us is that students of color are very quickly removed from their trajectory of success into a pipeline of failure. Next slide, please. So the first thing we want to look at is the Crown Act. And the Crown Act creates a process to combat and reduce hair discrimination in all workplaces and academic settings throughout Texas. Next slide. Black women are 1.5 times more likely to be sent home from their workplace due to their hairstyles being considered inappropriate. They're 80% more likely to change their hair to comply with the office setting. And more Black students, especially Black girls, actually violate codes of conduct due to their hairstyles, which may be protective in nature. There are no national legal protections, although the Crown Act has passed in Congress, the House, it languishes in the Senate. The Texas legislature has no formal clear process for bills to ensure protection against race-based hair discrimination. And the loss of employment to Black people related to hair discrimination, as well as children being removed from their educational setting, is indeed a problem. So our recommendation is to pass the Crown Act that ensures protections that make all types of environments free from any discrimination based on cultural or protective hairstyles. This will decrease disparities by ending a form of discrimination that removes Black adults from the workplace and Black children from schools. It will also address systemic racism and free Black children and adults from a cycle of discrimination and inequities that often trap them. And we're hoping that Texas lawmakers passing this act will bring us one step closer to creating a fair and equal society for all Texans. Next slide, please. We also want to take a look at reinstating the Office of Minority Health Statistics and Engagement. Next slide. If you take a look at this chart, you can see how maternal mortality per 100,000 births is so much higher for Black and Hispanic women in Texas. And we heard about that earlier from Dr. Bikini. But this Office of Minority Health Statistics and Engagement, if reestablished, would create a mechanism to take a deeper look at racial disparities in health and human services and to come up with solutions. The office would work with communities where disparities are found and create policies and programs that are community driven and that prioritize equity. Bottom line, we need to know the who, what, where, when, and how these disparities happen and how to eliminate them. This office would centralize the information about health disparities and create a hub for existing local and federal offices to facilitate a cohesive relationship geared toward promoting access to healthcare for all Texans. What would basically happen is that this office would allow us in the state of Texas to talk about these statistics so that we can be about making a positive change. Next slide. Finally, let's talk about the sunset process. The sunset process is that process by which all state agencies are reviewed and evaluated by the legislature on a revolving basis. Next slide. We believe that we can address racial disparities by including in the sunset review an examination of state agencies with the goal to examine the efforts of the state agencies' ability to reduce disparities to the list of analysis that's conducted during the Sunset Commission's statutorily required review. So this bill would require the Sunset Review to assess the agency's efforts to reduce racial disparities and utilize an existing process in the Sunset Review to evaluate how different sectors of state government address racial disparities in the area that they work in. It's important to note that TEA and the Department of Health and Human Services oversee the largest public services to Texans. And 65% of over the 1 million Texas children who had classes canceled because of COVID-19 were Black and Hispanic. And Black and Hispanic Texans were 71% of the state's uninsured population in 2018. So it's important that we take a look at how agencies either contribute to these disparities or how they work to dispel them. So by ensuring that agencies like TEA and HHSC are working to address racial disparities in their work, we move one step closer to being a state where everyone benefits from an equitable playing field. Next slide. So in summary, our policy recommendations are to require the Sunset Commission to assess state agency efforts to reduce racial disparities, to prevent discrimination against natural and protective hairstyles in academic settings, and to reestablish the Office of Minority Health Statistics and to renew their funding rather. I think that's the final slide.
All right. Hey, Sharon, a question sort of related is that when we look at school rankings, when we look at early childhood, we know that about 66 to 70% of all the children in the state of Texas are children of color. And those children are much more likely to go to some of the lower performing schools. Do you see any movement in the near future to make sure that we're paying attention to those schools? Because we know that part of that path out of poverty, part of that path to success is going to a good school. Does the state seem to be interested in that?
I hope so, and I think so. Again, it's a matter of us creating a pipeline of a workforce that will sustain this state economically, and we just can't do it if we are leaving any of our kids behind.
Yeah.
Those who are Black and brown who are increasingly trending toward being a majority minority in this state.
Yeah, excellent. Very good. Keep up the great work, Sharon. Thank you so much.
Thank you.
Very good. All right, let's talk about hunger and food insecurity. Jamie Olson is with us. Jamie is the Director of Policy and Advocacy with Feeding Texas. And I know she's going to pop on the screen here in just a second. One of the great things that we have in the state of Texas, Feeding Texas, which brings a lot of groups together to focus on ending hunger, ending food insecurity. And Jamie, this should be one of the easy issues, right? Because there's a lot of federal money that we don't take as well, much like health, in regards to food insecurity. But give us an idea of what this legislative session looks like. And thank you very much for being here, Jamie.
Of course, thanks for having me. And yeah, you would think that there's a lot of money to take advantage of, and we're focused on ways to maximize that. So if you could go ahead and hit the next slide, and again. And I just wanted to mention really quick, I'm here representing Feeding Texas today, the State Association of all the food banks. But I'm also here representing the Texas Food Policy Roundtable, which is a coalition of organizations dedicated to improving policies to address hunger. And we have, over 60 organizations with over 90 members now, so growing all the time. Next slide. As Bob mentioned, child hunger in Texas is a real problem. With real implications. So 1 in 5 Texas children are facing hunger and food insecurity. And we fortunately, though, have tools to fight it. SNAP being the nation's largest and most effective anti-hunger program. And that's why a lot of our priorities this session do focus on the Supplemental Nutrition Assistance Program. However, I did want to highlight, for those on this call, not only are millions of Texans children enrolled in SNAP, but it's also a critical gateway to free school meals. So anytime a student is enrolled in the SNAP program, they automatically receive free meals through the National School Lunch Program. So that linkage there just makes it all the more important to get eligible children enrolled in the program. Next slide. So one of the policies we're focusing on this session is to modernize the vehicle asset test. The vehicle asset test is essentially a limit placed on the value of a person's vehicle that they can own and still qualify for the program. Right now, the vehicle asset limits are severely out of date. The last time, there's 2 limits. The first car is $15,000, and that hasn't been updated since 2001. The secondary limit, which is for any subsequent vehicles that a household owns, is $4,650, and that hasn't been updated since the 70s. And if you've ever tried to buy a car recently, you know that $4,000 isn't going to get you a very good one. So we really need to update those limits. This is also a racial equity issue. We have data that shows that this policy disproportionately harms Black and Latino households, especially any households that have 2 parents or multi-generational households. And a recent phenomenon we've seen, which is heartbreaking, is that due to recent inflation, used car values have spiked so much that people who are currently on SNAP are actually losing their benefits at recertification. So they haven't bought new vehicles, it's the same car, but they're having their food assistance taken away from them. So we really need to focus on this. This is our #1 priority for the Texas Food Policy Roundtable, and we think we can get it done this session. Next slide. Another thing that we'd really like the legislature to consider this session is extending SNAP certifications to 12 months for families with children. Most SNAP households have to reapply every 6 months. This creates a lot of work for the agency, and as many of you probably know, HHSC is dealing with extreme staffing shortages and a real backlog in applications currently. So this can reduce the burden on our state's eligibility system, saving time, saving money. It can also decrease churn, which is the phenomenon where we see people drop off the program, not because they're no longer eligible, but simply because they didn't get their paperwork in on time, just those administrative steps. And then they have to reapply and get their benefits reestablished. So that when that happens, we call that churn, folks dropping off and dropping onto the program. And that's also burdening the eligibility system. So next slide. Told me I have 4 minutes. One thing I think I wanted to highlight, this is a priority of one of the partners of the Texas Food Policy Roundtable, the Share Our Strength organization that funds the No Kid Hungry campaign. And I wanted to highlight it specifically for this webinar, but they're seeking to eliminate the reduced price category in the National School Lunch Program. So as you all know, that NSLP provides free school meals to a lot of children, but a lot of children who are between 130 and 185% of the federal poverty line still have to pay a reduced price for their lunch, and families struggle to even pay that reduced amount. This can lead to children accumulating school lunch debt, school lunch shaming in the cafeteria line. When they're not able to pay their balance, they're given a sad sandwich kind of substitute, and then obviously leads to hunger and inability to learn. So by eliminating that reduced price category, a lot more Texas students could eat for free. This would come at a price, of course, so that would require funding from the legislature. Next slide. And finally, we do have a priority about reducing hunger at community colleges. And of course, I know we're focused on children in this space, but I think there are a lot of children, exiting the foster care system and things of that nature that really tend to struggle, especially when they're entering the realm of higher education. And so unfortunately, access to SNAP is severely limited by federal regulations. And we're working within those federal regulations to increase access to SNAP where we can, which is specifically for students at community colleges and in vocational and technical degree and certificate programs. And that's it.
Oh, that's fantastic, Jamie. And I want to say, I was a kid who got free school lunch, and but I knew, other kids that would just not do it because they didn't want anyone to know that they were free. But I never passed a free lunch myself. So one of the things that I wanted to ask you, though, is people often don't realize we have some of the best food banks in the world right here in Texas, right? And we learned a lot through collaboration during the pandemic, food banks, working with school districts. any of that learning that we did, has it meant that there are changes coming in the way that we're feeding kids and the way that we're trying to end hunger?
Yes, yeah, the pandemic was a time of strife for many, but also a time of real innovation. And I think, one thing that I really want to highlight, and it didn't make it onto the slides because it's more of a federal legislative priority, but it's the innovations around summer feeding. Summertime is one of the hardest times for families and children experiencing hunger because they don't receive those free breakfasts and lunches at school. And so summertime, we see a real spike in childhood hunger. And what we saw during the pandemic was the introduction of PEBT, which is, EBT cards that went to all those families. Texas has distributed billions of dollars in PEBT through the course of the pandemic. And I think it really made a huge difference in the lives of those families. And we're pushing for there to be a nationwide permanent summer EBT program to continue that, because prior to the pandemic, the congregate feeding models that our food banks and schools have to utilize to feed children, they just don't work.
Yeah, there's so many winners when you do the EBT cards, right? I mean, grocery stores, so many people that just come out ahead on this. So thank you very much, Jamie. Thanks for all the work that you, Celia, and the whole team do over at Feeding Texas. We so appreciate it.
Thank you.
Oh, very good. All right, let's go to our next panel. It's a great panel, and I'll have them come on. Chris Wallace is with us. Chris is the president and CEO of the North Texas Commission. Welcome, Chris. Becky Callahan, who's the director of Philanthropy Advocates, a great organization. Thanks for being with us, Becky. And then Deb Zuluaga, who's the president and CEO of United Way of El Paso. So we have people from all over the state here. Chris, let me start with you. So many times, when we think about business involvement, right, and that you have a council of business, people think, oh, they're just after tax breaks. They're not really thinking about kids. But talk about sort of the synergy there, right? Because businesses care about the future workforce and the quality of that workforce.
Absolutely. And of course, the future of the Texas workforce pipeline is in our Texas public schools. As you know, Dr. Bob, and again, thank you for what you and all of your team does to focus on children and families in the legislature. Many industries are experiencing still a workforce shortage, supply of workers. No different, right, in our public schools. And so anything we can do to increase the teacher workforce supply and resiliency is going to be key this next session, as we all know. Safety is certainly paramount for our kids, our faculty, our staff. We are certainly looking at businesses are concerned about funding for their kind of more the wraparound support systems, including mental health, I know, which was discussed earlier today, high quality pre-K, early childhood education, of course, which Children at Risk is a champion of. And so you're right, businesses are supportive of the entire picture because they see that this is the future in terms of our workforce. So just like last session before last, all eyes, all priorities have to be on our workforce pipeline and our children and the families that support those children.
Chris, I know a lot of business groups, I'm going to be specific now, a lot of business groups have come out against vouchers, right? There seems to be this movement towards vouchers. And we keep coming back to it because I feel like we've presented evidence time and time again to the state legislature that really shows, that the better experiment was charter schools, and vouchers where there's no accountability is really not a good use of public money. And people keep thinking that the top private schools are just going to open their doors and and we know that that's not the case, right? The evidence doesn't support vouchers. How difficult is that going to be when it's a big national issue as well? Absolutely. Around this issue?
Yeah, I think it says a lot when our commission board made up of public and private sectors within our 13 counties of North Texas unanimously supported the transfer of public education funds to non-public education entities, for-profit entities that are taking funds away from our public schools, our traditional public schools. And so I think it's going to be certainly an uphill battle in the Senate. It's one of our lieutenant governor's top priorities. It was in the interim charges. I think we'll see more of a reasonable look and view and some opposition, certainly from rural legislators, particularly in the House. I think we may get there on some sort of vouchers. I don't think it'll stand up in court if it's focused on large metropolitan areas versus rural areas. It's going to be interesting to see what formula that they come up with, but we will adamantly oppose vouchers.
Yeah. It's interesting because people often forget rural areas don't want vouchers because there are no public schools, right? And they want to support, sometimes the largest employers, many times the largest employers of the school districts. Yeah, very good. Becky Callahan from Philanthropy Associates. Becky, give us an idea from your perspective. What are you guys wanting to see in this next legislative session?
Sure. Thanks for having me, Bob. Yeah, Chris said it really best. Honestly, we're aligned with the business community and education advocates like Children at Risk that the future of the Texas workforce and the benefit of our economy and economic opportunity for students and our teachers is in the education system. So Philanthropy Advocates, as a group of funders who funds direct programmatic efforts to make sure students have access to higher education, who have access to full day high quality pre-K and childcare, and are really conveners in communities and leaders in making sure sectors are working together. We're focused on those same topics that Chris mentioned around early childhood education, effective teaching, and access and completion in higher education.
I know that in the past, you guys have funded some great research projects. I mean, I think the launch, right, of you guys was when we funded a whole study of how public education was adversely impacted by a cut in the budget. When you guys sort of look at sort of a pet piece of legislation or a pet project right now, what are you looking towards?
Gosh, we have the whole cradle to career spectrum. So there's several opportunities, I would say, in the legislative session. One of those pieces aligns with Children at Risk around the pre-K partnerships and thinking about how do we expand access to quality, because we know that Texas parents need access to both childcare and pre-K, and those students need access as well. It only benefits us on the kind of outcomes end of education. And again, thinking about the future workforce and economy. And again, the economic opportunity for those students. The Community College Finance Commission also is a really strong opportunity. I would encourage everyone to pay attention to that and lean in, thinking about not only how is that impacting community colleges for the students, traditional students, adults returning to community colleges, regional workforce development, but also how it impacts the intersections of early childhood education. Often community colleges are providing access to childcare and providing education for the parents and childcare educators. So I think there's a lot of really neat opportunities and intersections that Philanthropy Advocates will be leaning in on around, again, thinking about how do we support strong education systems that will increase economic opportunity and outcomes for students and the state.
Deb, who's out at the United Way in El Paso, and you represent so many different interests, Deb, but when we look at United Ways across the state of Texas, that represents so many of these very strong backbone organizations that are helping our communities. There was a time I remember a big metropolitan United Way saying, well, we're not going to do policy anymore. And I think things are changing, right? That people are understanding the legislative session could have such an impact on those nonprofits and United Ways across the state. What have you guys been seeing in regards to that and that greater voice that many nonprofits and social service agencies can have in regards to the legislative session, Deb?
So I think what more and more of us are realizing is that you have to use every single quill, every single arrow in your quiver, and certainly policy and advocacy are wonderful ways to engage elected officials and other state leaders and local leaders around areas that can create some commonality in some of the areas that we're talking about. And I want to kind of build on some of the things that Becky and Chris have said. I think there is an intersection of so many different pieces: philanthropy, grassroots programs, agencies, foundations, and resources, both from a policy perspective and also from a funding perspective from local, state, and federal sources. And I think to just walk away from any one of them is not going to be of a benefit to any community. You really have to make sure that you're addressing it from every single angle.
And so you're down in El Paso, right on the border. Are there border issues that you think, sometimes when I'm in El Paso, the Rio Grande Valley, people say the state legislature never pays attention to us. But are there border issues that you think will sort of rise up and people will be paying more attention to this time?
So, I think they're the same issues all over the state. I mean, obviously, education, mental health, one of the things that kind of building on, again, what Chris was talking about in the business community and workforce, and also is the recognition that quality schools are critically important, but there's also has to be a recognition that stable families are critical to helping children succeed in school. So we have to reach those. And so I think many of the issues perhaps are more pronounced when we come to the financial issues facing border communities, our levels of poverty, our levels of relationships around access to resources are certainly a little more pronounced in many of our border communities. So I think they're the same, they just perhaps have a greater impact in our communities. Yeah. And I also want to mention, the other thing is that I think while we're talking about schools and school safety, we need to make sure that we are including in the conversation out of school time programs and making sure that children are as safe in out of school time and early childhood programs and locations and facilities as we are in the schools.
Yeah. And there are some issues, Deb, right, that are very important in terms of moving things forward that will never be talked about in the state, and we talked earlier with Dr. Bikini about Medicaid expansion, and I think after Uvalde with guns. And are there things, though, that we should be talking about that can be talked about that haven't come up during our discussions?
Well, I think there are topics that we are talking about. I mean, we're talking about, disconnected youth. You heard Mandy talk about opportunity youth. We're talking about again, and I think that's a little bit of the key to it is staying away from, not staying away from, because you can't stay away from it, but certainly recognizing that there are some wonderful opportunities for us to build a stronger communities through stronger education, early childhood education, quality out of school time programs that will help opportunity youth. And so I think we can talk about those ways that we can come together from both sides to address some of these issues that are kind of the root causes of some of the challenges we have. And I think that, so often the most controversial tends to be what floats to the top. But I think there's so many things that we can be doing in our communities with our, again, with all the partners and especially with our elected officials that are really can be a real change in addressing root causes of our community issues.
Yeah, very good. Thank you, Deb. And thanks for answering a series of questions from me as well. So, Becky, I wanted to ask you, it's often said that everything that people talk about between Labor Day and Thanksgiving around political issues and legislative issues are what ends up sort of being the headlines during the legislative session. And so if you were, one of the things we know is we're going to have more funding this time, right, than we've had in a very long time in Texas because of high oil prices. And so if we were to be bold and to say, all right, instead of talking about returning money or cutting taxes or giving property tax relief, which are all good things, but if we were going to talk about how do we sort of move forward, how do we use this money in a way that like it's a gift, let's do something bold with it. What would you guys be saying at Philanthropy Advocates? What are you saying it would be a good use of that money?
Sure. And, I think that's a great question, because if we recall in 2018, 2019, we were going into a similar sort of situation where the state had a surplus of dollars that could be invested, and they chose to invest in school finance. And I think that's a real mirrored opportunity right now. Of course, the Community College Finance Commission that I mentioned already, I think that is going to have legs and has a lot of opportunity. And to, as I said, think about breaking down silos within education and really think about the holistic experience of students and teachers. We really have the opportunity with the surplus of dollars to invest in our future economy and invest in our current workforce through our teachers, our childcare providers, and think about how do we braid all of this together really strategically use the surplus of dollars to invest across systems. We have the Tri-Agency Workforce Initiative in the state of Texas that has been making real progress on shared goals and operations that can be an entity to help steer the braided funding, the braided solutions that the state has dollars to put forward. And I really think you mentioned messaging and kind of what's on the table between Labor Day and Thanksgiving. Shameless plug, we're trying to get as many voices on this call and in the state talking about this opportunity to advance our economic outlook in Texas by investing in education. So I'll put a couple links in the chat, but we have the time now, certainly post elections in a week, to be talking about all of this opportunity. And I think from our perspective is, let's talk about it all and let the legislators make the decisions on what maybe they do or don't want to invest in, but we shouldn't sell ourselves short in understanding the big opportunity we have here to invest in education, cradle to career, so that philanthropy, business, providers, all of us are working together with the state legislature for our systems and our future economy.
Yeah, and when you focus on education and public education in Texas, you're hitting everyone, right? You're and every spectrum. It's a very equal opportunity sort of way to invest. I want to ask each of you the same question that I asked Becky. Chris, is there something, we have more money? Be bold, but what would you be bold with?
Yeah, we're actually, our team, Dr. Bob, is putting together a list of priorities now to take to our leadership and ultimately to our delegation, our 41 House members and 9 senators from North Texas. But I totally agree with what Becky said. It has to really be long-term outlook. Those allocations that are going to prove return on investment for the future. So if it's within state agencies in terms of modernizing technology, modernizing for more efficient use, but non-reoccurring expenses, right? Because we may not have this surplus in future bienniums. Certainly when it comes to education, that's a wise, certainly ROI, positive investment for our future in terms of workforce pipeline, but school safety. Those schools who have not had safety measures put in place, certainly that is certainly going to be key for us, particularly in North Texas, well, really throughout the entire state. Infrastructure, including water infrastructure, and what that looks like with our state water plan. And finally, a teacher retirement system. Make sure that funds go to make sure that our retired teachers are taken care of.
Wow, very good. And what an opportune time to take care of teacher retirement when we have a teacher shortage, right? Let teachers know that we care about them. Absolutely. Very good. Deb, how about for yourself? What are you thinking? If we're going to be bold, what should we be doing?
I just hate to echo what everybody else said, but I think it is pretty much the same. And I think, again, the needs of our state are the same as the needs of our community in varying degrees as we are in each area of the state. But early childhood education, I go back to, making sure that our out of school time programs have the same safety and our early childhood centers have the same safety protocols and access to resources to create safe spaces for our attendees. And of course, mental health. And again, those for El Paso, those very financially empowering efforts to make sure that more and more families are on that road to financial stability that will then impact, again, the quality of how well their children do in school. And, again, improve the workforce in the long term. I think anything that we can do that will provide, echoing what Chris said, that will provide long-term results. And it can't be just what can we get done? What are we going to invest in that's going to help get all of our children and families on the path to success?
I want to ask all of you another question. As we go into this legislative session, there's always a lot of disinformation, misinformation. There's always some big worries that come, like, oh, I hope that doesn't get traction. And so I'll risk us talking about it. But I want to know from you, and as an example, Chris, for me, one of the big worries is that this idea of not mandating vaccines for all kids, going into kindergarten. And I've heard some misinformation about if we do that, we're also mandating the COVID vaccines, and that brings up all sorts of images for parents, that, most of our parents, half of our parents, certainly in Texas, don't want their kids to have COVID vaccines. So they may sort of decide, hey, I don't want childhood vaccinations. That, for me, that's the biggest issue. What for you is the biggest sort of misinformation worrisome issue?
Yeah, of course, any bill that would damage our state's reputation as business friendly, our ability to attract future talent from all over the world. We have a lot of assets which businesses are attracted to. We continue to be top of the list of business relocation, and we want to keep it that way. So any piece of legislation that deals with these ESG type issues, critical race theory, anti-LGBTQ, that are harmful for business and harmful for our competitiveness. We're also very focused on economic competitiveness tools, particularly Chapter 313, to give our school districts some incentives to be able to draw manufacturing projects and give some relief to those projects for high capital intensive type projects. So that's going to be certainly a priority. And finally, anything that would be anti-local control, including our school districts, not only our cities and our counties, but our school districts as well. And I think it's going to be another challenging session like we had last session and the session before last on a whole host of issues related to anti-local control.
Everyone's always for local control until it's an issue that they feel
right. And I mean,
about, right?
Our state leaders and legislators are telling the feds, stay out of our business. Let us do it the Texas way. No different with locals here, right? Stay out of our local business, state. Let us control our own school board, our own city council, our own county commissioners court, et cetera.
Yeah, very good. We have about 4 minutes left in the panel. Becky, how about for you? Misinformation, disinformation, worry?
I think one of my worries in our focus of effective teaching is just really grappling with the nuance for the teacher workforce, the clear understanding that our teachers, I mean, they're everyday heroes. We saw what they went through COVID, and we see the passion and dedication they have to our students and the love they have for education and our students. And so they're such an important part of our workforce and our communities. And so something that I worry about and we want to make sure that we focus on is really preparing teachers and supporting teachers in the profession. And in a time right now where there is a difficulty in hiring teachers, and it is really regionally and geographically based on kind of what teachers, what classes, what grade level, et cetera, we want to make sure that we're not lowering the bar of what it takes to become a teacher, because teachers really should be likened to doctors and how prestigious and professional that career path is and important. And so I just want to make sure that we can bring nuance to the conversation around how do we balance with having to find teachers to hire and that struggle with also making sure we're not just putting people in the classroom who are not prepared to be there. It damages them as employees and individuals, and it does damage for students and, our future economic outlook. So that one is a worry for me and kind of what discussions might be on the table around the nuanced details of how we address the teacher workforce right now.
Yeah, very good. Deb, do you have a big worry?
Just anything that takes the oxygen out of the room, that takes away from us focusing on what we at the state need, and that is early childhood, quality out of school time programs, mental health, financial stability. I think any of that noise just draws attention and away from what we need as communities to build a stronger state.
That's there's bound to be something that takes the oxygen out. They always find something, don't they? The state legislature, they find something that is inopportune and just nonsensical.
And
so
coming out of a pandemic and now with the economic challenges, it's more important now that we really keep focused on helping the legislature or community stay focused on what is going to improve the state of Texas in every community.
Yeah, very good. Thank you all very much for all the work you do, for being part of this panel. Deb Zuloaga from the United Way in El Paso, Becky Callahan from Philanthropy Associates, Chris Wallace from the North Texas Commission. Thank you guys for all that you do and for helping us as we move forward with this children's agenda. Thank you all very much.
Thank you.
Take care.
Right, very good. So let's go to our next panel, and we have my good buddies Mandy Sheridan Kimball, Jason Sabo are with us. And for those of you who don't know Jason Sabo, I love this, Jason. Michael Kelly, who's at the Paso del Norte Foundation, said Jason Sabo, he's sort of like a walking TED Talk, isn't he? And so I always love that description of you. So give us an idea, guys, this upcoming legislative session, your thoughts about it, some of the pros and cons. Jason, I'll let you start.
Well, I'm excited about it actually, because I'm one of those weirdos who gets excited about it. I always tell people it's like every 2 years for 6 months. I live in a broom closet at the Capitol most of the time. And then every 2 years for 6 months, they let me out to run around, and then they put me back in or turn into a pumpkin. But last year they let me out for 9 months. It was amazing. It was terrific. So I'm actually really excited about this session, and I hope people are too. And I think that we could not have had a better segue than we had from Deborah Zulawaga a minute ago, because I a minute ago I texted Mandy and I asked her if I could use a word, and she said, "Well, a guess." So this is I'm to blame here, Bob. And I was like, it's the battle of the bullshit that we're confronted with, I believe, because there will be so many issues that are designed to distract us, to discourage us, to kind of take us off target, to take us off focus. But as long as we stay focused on the things that we care about, and remember what you just had laid out for you by all the Children at Risk folks and Dr. Bikini and others, is a very clear set, not of ideas, but of actual pieces of legislation, bills that will be moving through the process that you can follow and monitor over the course of the next 7 months. And I'm optimistic about this session. I'm one of those people who always believes that there's opportunities to bring people together. And I think that if we're using the right language, if we're talking about the issues in the right way, we will be heard and we'll be successful on the things that were just laid out and much more.
Mandy, how about your take?
I'm excited, and let's go. We can do it, right? What I'm excited about is that there is a clear path, but this past year, last session felt like it never ended because it almost didn't, right? It was one after another after another. But when it was done, you had the governor and the lieutenant governor and the speaker charge or direct committees to study particular issues. And when we look at the issues that were studied over this past year, there are issues that we care about. I mean, you heard Becky talk about the Community College Commission. That wasn't an interim charge, but that was a thoughtful group put together to say, this is an issue that needs to be tackled. Let's bring all the experts in and focus on that. When we look at key committees, International Relations Economic Development Committee was charged at looking at childcare. And how do we increase access to quality childcare, knowing that it is a workforce issue, and how do we strengthen our economy? That's a great opportunity for us. Public education was looking at pre-K. They were looking at chronic absenteeism, and how do they work with higher ed? When we talk about human trafficking, there were different committees focused on human trafficking. So part of it is, our obstacle, we create agendas, and then January comes and there's like 6,000 bills filed. Well, legislators can't be experts on 6,000 issues. So what's in our favor is that we've had a year to educate them, to hook them, for them to be prepared and really find those champions. And I think when I look at the upcoming session, we have bipartisan support on key issues that we care about. There will be some challenges, there will be some noise, or as Chris said, oxygen sucked out of a room. But if we stay focused, if we keep going, I think that there can be wins. And an example is, look at last session. It was crazy. It was a crazy session. It was dark. It was very dark. But there were still several good things that passed. And so we have to remember that we can do it again.
Jason, over the years, we've had pieces of legislation that sort of like push the envelope. If they pass, we didn't expect them. Usually Mandy has a little dance that she does when we pass those pieces of legislation. I wish I had a little video of Mandy's dance, but I think about when we mandated school breakfast in every school over 80% low income or the full day pre-K, or, is there an issue like that you're thinking, well, it's maybe a little bit of a long shot, but it really could happen and it would be really good for kids and families?
Right. One of the things that I think we all need to be mindful of is kind of where the conversation is. And I think that we're successful from an advocacy perspective if we're not coming out of left field, if we're kind of thinking through very, strategically where the momentum is, where the opportunities are, where the amendable bills are going to be, how do you move things kind of through the mechanics of the process. And I think one issue that jumps out at me is something that Children at Risk is talking about related to property taxes and childcare centers, and looking at, the research that you all did, which I think is incredibly interesting and important, looking at what happened to the childcare community in Texas. I think your numbers, correct me if I'm wrong here, Kim and Mandy, but 21% of childcare providers closed down during the pandemic. And of that 21%, 75% of them were family day homes who are typically serving very low income, mostly kids of color, and are typically small businesses that are run by women of color. And I think that if you look at something like these different kinds of strategies, like property taxes, how can we begin to think differently outside the box to look at the data and then begin to address the concerns that are being reflected in that data?
Mandy, how about you?
One thing that we really need to do that I'm hopeful that might be a stretch, and we can talk about another issue after this, but I'll stick with childcare, is we have to invest in childcare. We have closures. We don't have enough teachers. It's hard to get teachers when the average salary is $10 an hour. We're competing against Whataburger and Buc-ee's, and it's a difficult situation because those teachers are paid off the backs of parents. Parents can only pay what they can afford, and childcare providers can only pay their staff of what is coming in. And so one ask that we have, and I've been talking to leadership, is Texas has got to invest in childcare. It's mostly federal dollars. And how can we step up and have some bedrock funding, which you heard from Kim Coffran earlier, to take care of staff, to take care of childcare deserts, to make sure that we can take care of our infants and toddlers because they're more expensive to care for. And so this is something that we really need. The childcare providers, yes, but then also public education. And that's what Becky is working on, is how can we get the public education sector talking about childcare, because it's all connected, right? And the workforce, how can we make it work? So that's something that will be a heavy lift that I think we need lots of people working on.
You said you had another issue outside of childcare that you wanted to mention, maybe would be one of these long shot possibilities.
Long shot possibilities as well. Human trafficking is an issue, and Caroline laid out a long list of human trafficking issues. One of them, and it's a little bit probably out of the realm of what this group usually focuses on, but it's the ATMs, right? And how, like, Texas leads the nation in enhanced penalties of traffickers. We actually put quite a bit of dollars towards survivors, but we've really got to figure out and focus on the prevention. And part of that is demand, because as long as there's a demand, there's going to be a supply, and it's extremely lucrative. This criminal industry is extremely lucrative because you can sell a person over and over and over again. It's not like drugs, you sell it once and it's gone. So if we have, this money laundering or these ATMs and these illicit massage businesses that are being untapped and there's no accountability, it causes a problem and allows this industry to go. And so really trying to get the financial institutions along with child advocates to say that this is a priority and a significant step that would end human trafficking in Texas is something that we need to do.
Jason, I want to talk about money. We keep hearing that there's going to be a lot more money. How much more money are we talking about, and what's likely to happen with that?
I do think that there is, folks have heard a lot about, this budget surplus, and I'm glad to hear you, frame that question without using the word surplus, because every time I use it, I have to do this thing with my hands to reinforce the point, which looks ridiculous because I'm doing this. I want to remember, not a surplus. what ultimately we have in front of us is a big pile of money that is in part because, this Texas is comparatively wealthy, but is in large part because we have a lot of federal money that came into the state and we were able to supplant some of it. And now we have available state resources through what is ultimately a very clever budget shell game. And so when you're thinking about the money that's available, put it in that context. And remember the number, I'm sorry, you asked is $27 billion is kind of the official number. It's going to be mid 30s would be my assumption, right? So maybe, let's just go with 35 just for fun. So what we've already know is the governor has pledged that half of the available surplus will be used for property tax relief, as you mentioned earlier. So that cuts 17.5 off the top. And then we know that with regards to broadband, if we're really going to do broadband, as you say we're going to do, that's $5 billion right there. So let's assume not all of it, but half of it, because easy math for me. That makes it 20. We're up to 20 billion. The controller has already said we need to hold some of this money back because we're moving into a recession. So we need to be very careful and we need to be conservative in our budgeting, knowing that the next legislative session, we're not going to have this largesse. And the governor himself has already put out about $1 billion worth of proposals as to how to use these dollars. Mostly, not surprising, but some things like of note, new elementary school for Uvalde. So a lot of money for school security, which something people on this call have talked a lot about. Some other funding for school security stuff like hardening kind of things. So there's just generally some money coming there, but all of that to say, most of that money's accounted for over and over at this point, really.
Mandy, anything you would add on the money? No. Okay.
No, except for thanks, Jason, for bringing in reality, I guess. But I don't think it should deter us from asking. That is our job as advocates or as providers or teachers or whatnot. You never know. And I remember talking to leadership office and I was like, I'm going to have to ask you for money. And he was like, I would be disappointed if you didn't. Why wouldn't you be asking? And so it's upon us. There is competition, but to be organized and not bashful and demand and ask for funds that we know are needed for systems that are currently underfunded.
Absolutely. And one thing folks need to know is the bill is moving through the process. It will have a cost estimate, completed upon it, which is called a fiscal note. And if your bill in some sessions has a fiscal note, you can't even get a committee hearing. When there's a surplus like this, they're willing to float bills through the system that will only cost the state, let's say, $1 million. So I think that as you're thinking it through and how you want to approach this, I would urge people to remember that there are these opportunities to move bills that have a small cost that you might not necessarily have an opportunity to move other sessions.
I wanted to ask you about, there was a question earlier in the chat about advocacy. And, we live in a state with very low voter turnout, especially during non-presidential elections, right? So there's not a lot of civic engagement. It's one of the lowest turnouts in the country. And yet, we still want people to go to Austin with us, right? So there's just not as much civic engagement as we would like. But if we had the best of all worlds in terms of going to Austin, and people need to understand that a little goes a long way. I think about 17 years ago, guys, when it was Mandy and I were Children at Risk, and we hired you, Jason, to help us legislatively, and we still passed, I think, 7 pieces of legislation our first time we did that. So a little can go a long way. What do you encourage people to do? And I'll start with you, Jason, on this. How can people, nonprofits and others across the state, especially now that we have the Texas Family Leadership Council, how can we be more proactive and how can we be more victorious when it comes to children and families?
Mandy mentioned this earlier about last session. She referred to it as dark. I'll refer to it as lonely because I was there, every day, passing through the Army tent, getting a thing jammed up my nose, doing the deal, right? And it was no fun. And it was, I'm gonna rephrase, it was less fun than normal. And, it was nobody was there in the long and the short of it. And I think that after literally a month of no one being there, the system itself changed. I've watched the legislature. It's an organic creature, right? I've watched this creature from afar for 20 years, right? And it was a different creature last session. And I think that because the public wasn't there watching, because one of the things about the Capitol that makes it such a beautiful place is it's the literal, it's the crossroads of Texas. There's no other place that I go in the state where you can sit in the Capitol Rotunda and you literally see every kind of Texan walk by within the course of 10 minutes during the session. That didn't happen last session. So number one, I think people need, for effective advocacy, we do need to be there. And I think that we always say that, but I think that this session, because of the lack of presence last session, a lot of the issues that we care about, it's more important than ever for us to be there. And number two, we need to do a better job of speaking the language of the system itself. And the system itself, it's politicians. So we need to remember that our job isn't to say what we feel and what we think. Our job is to figure out how we take those ideas and articulate them in a manner that a politician receives, that he understands that if he does what we want him to do, he will have more motivated voters when he becomes a candidate or she becomes a candidate again. And it's all about how do we make that kind of guttural connection with people. And we need to start talking about our issues using the language of today, which is how do we talk about inflation? How do we talk about how prices are affecting families? How do we take our work, which is all about those very issues, and talk to legislators in a way about our issues that echoes what they're hearing from their larger constituency communities.
Mandy, what would you add?
To build on what Jason said, yes, if you can go, be there. The doors are open. They want to see you. I also think that last session opens up an opportunity that you can have meetings virtually as well with legislators that are easier than it was. So if you're in El Paso or in the Panhandle, that you can have a face-to-face. It might be a screen, but you can have these face-to-face conversations. And the most important thing is to make sure that they know what your messages or what your priorities are. So meetings, absolutely. What's also important is you can have the conversations about important issues, but getting it out in the open and putting pressure on legislators is important as well. So op-eds, why, we all learned how to write them way back in the day. Let's use that skill in 700 words. Why is this issue important? And a teacher is an excellent author for an education issue, or a parent, or a provider who's doing after school, services, making sure that their voices are heard, and the media will pick it up. And it's upon us. If we want children to be a priority next session, we have to keep it up in the air in messaging across Texas. So I would say that's really important. And then, and letters, you could always do letters as well. Testifying, there's a lot that we could do.
Jason, I remember one of the first times that I went to the state capitol, you would hear people be extremely nice to each other. I remember sort of emceeing the day on human trafficking on the steps of the Capitol, and I introduced Leticia Van de Putte, who is a Democrat out of San Antonio, and she began to say really nice things about Attorney General Greg Abbott. And I was a little surprised that when you go to the Capitol, people were really nice to each other, no matter what the party was. But I think things have changed, right? They're not as nice anymore, though you still see some of that. Talk a little bit about that and that's impact, sort of this whole political division, and how will that have an impact on the upcoming legislative session?
I think that this session is probably, we've seen it kind of creeping into Texas politics. I mean, the language has always been, don't make Austin like Washington, right? And that has very much become the case. And the worry that I have is, I was talking to some folks about this yesterday, that if you look at the way redistricting happened, because remember, the folks who are coming into the legislature now are all brand new to these districts because we just redrew the maps. So this is the beginning of a 10-year cycle where we will be represented by this particular set of maps. And it's a different set of maps in that, I was with Representative Julie Johnson at an Operation Warm event in Dallas last week, and she told me that her district was something like 75–80% of Biden voters 2 years ago. So what has happened in redistricting is we took an already polarized primary system and drew districts that basically locked in both parties, with very, very few districts where you had folks who were sitting kind of on these margins, right, of potentially having a legitimate contest in November. There are fewer of those now. And I think that what that will fuel is a more primary focused, more rancorous kind of debate coming from both sides. Because now there is no reason whatsoever, not that there's ever been a real incentive for that, but now there is a perversely negative incentive to actually come to the middle, given the way these maps have been drawn.
Wow. So we still think we'll see some of this rancor, right? This political rancor.
I do. And I do think we're going to see some of that political rancor. And it gets back to where we were at the very beginning of this conversation. It's incumbent upon all of us to keep the focus on the stuff that really matters, because the carnival will begin. And I mean, I think folks need to understand that, like, the carnival, the way that the media cycles work in all of this, and Mandy's very right about how important that is. We're going to hit the election next Tuesday. And then, okay, there'll be a couple of minutes of reflection. In Texas, most likely not a lot of reflection, because most likely not a lot's going to change. Either it'll be a lot of reflection or very little reflection. Yeah. And then the immediate story becomes, in a week, they begin filing bills. So there'll be a big splash of news a week after the election about the bills that are being pre-filed, because that's the Monday following the election, and then the session essentially begins. So we're there. And I think that people need to be mindful that the process is underway right now. And we got to make sure that when that splash of intentionally inflammatory firecrackers thrown into the campfire hits, that we're like, okay, have fun with that. We're going to stay focused on what really matters, as Deb put it. Very good.
Mandy's always right, by the way. You mentioned Mandy was right, and I just want to mention that she's usually right. I'm almost always right.
And I actually have the happy dance on video. Should you ever want to, release it?
Thank you.
As
Thank
a
you. I think
for the organization,
it could be a good gift, don't you think? So anyway, we just have a couple more minutes. I want to ask you guys, and I'll start with you, Mandy. Biggest hope, biggest worry in the upcoming legislature. Be as specific as possible. No generalities.
Biggest hope. Well, I have to be a general, because did you see the list of legislative priorities? You can't just pick one, right?
Okay, go.
So the hope is that children are a priority, that today, the last 2 hours, we have heard several key pieces of legislation that can change the lives of children. There's no silver bullet. That's the reality. So there's several strategies, there's several bills, and we have to have a comprehensive look. And I hope that legislators see that they don't just check the box on one of the issues, like, oh, I helped kids, when it's, well, here's 15 other things that need to happen, so that we can have a coordinated, comprehensive approach to move the needle.
And biggest worry, Mandy?
Yeah,
biggest worry?
My biggest worry is that politics gets in the way of that.
Oh, man, you are so general. I might as well be moderating a U.S. Senate panel here. You guys.
It's time to go.
Jason, biggest hope, biggest worry?
Biggest hope. I have a kind of reputation as being nice, but actually I'm really vindictive and I have a long memory. And last session, the ATM industry killed our ATM registry bill in kind of a sketchy way. So my biggest hope is that we cost the ATM industry as much in lobby expenses as we possibly can. So biggest worry, I think Dr. Bikini and you articulated it clearly. We already know that legislation is going to be filed that prohibits schools from requiring a COVID vaccine. That bill is already in the hopper. It's going to be filed, most likely, we're hearing, by somebody who's gaining some clout on the issue. So stay tuned. That's one to worry about. But my big worry is public school vaccination requirements and childcare vaccination requirements, kind of writ large. If it were up to me from a policy standpoint, everybody hears me say this. I hate it when I say it all the time. Dig a moat around our immunization policies that we have right now. Fill the moat with kerosene, and put Claire Bikini with a pack of matches on the drawbridge, ready to do what she's got to do.
You don't want to mess with Claire Bikini.
Don't want to mess with Claire Bikini.
Very good. She has the health of everyone in mind. Yeah,
that is my big worry.
There are a couple questions in the chat and the Q&A here. One is an interesting question focused on, we've talked a couple of times today about we're not taking all the federal money that is available to us. It could be Medicaid, could be, the U.S. Department of Agriculture. Jason, can you answer that briefly? Why is it that we're not taking all the money available to us? Or what are
Politics. I mean, purely because we live in a system that is now driven by what matters in the two primaries. And if you remember the primaries, do you remember the primary? That was in March. And that was like a million years ago. That was the election that was really important, not the one next week. So if you weren't paying attention in March, tough luck. Fortunately, if you were paying attention, you would have known that some of the more extreme candidates did not emerge successfully from the primary. The speaker was able to keep his leadership team in place, in other words. So I think that kind of set the tone for where we're going to be. The tone for next session was set arguably in March.
And Mandy, biggest victories in a state like Texas that we can imagine, probably childcare. I would probably label childcare as a place where we're probably going to have the biggest victories.
I think so, yes, and hoping on education as well. But I feel that the pandemic has shone a light on the importance of childcare. It's never gotten its time. And so I think we'll be able to move things forward. But I would also like to add, you're talking about the federal dollars, politics, yes, but not all of it is free. Like, you have to have a match. And so part of our message to the Texas legislature is that you need to invest in this. If you spend 10, you get 90, right? Like, that's a good business move. Let's do it. Let's not say, oh, I don't want to spend the 10, so you're giving up the 90. We need to invest in our children, and rightly so. The federal government should expect us to take, to chip in for our people.
I want you guys to stay on and help me with the closing remarks, but thank you very much for this whole session. And Mandy, we have a couple of big days that everyone's going to be welcome to, right? Say the rally days, that's what we're calling them. The Human Trafficking Rally Day, Equity Rally Day, Early Childhood Education, and then Basic Needs. Those are fun, Mandy, and we encourage people to come and bring lots of people, right?
Absolutely. So we were talking about showing up, and I understand that people can't go back and forth like I do all the time, or like Jason is there every day. But it is important for us to show face. So these are just key opportunities, and it's fun. Bring your colleagues, bring your family, bring your friends, and let them see that people are coming here. And it's a great way to meet legislators. It's a great way to be educated on the specific issues and just advocate in general for children and families.
And then I'll add this, that people don't take advantage of enough. If you're part of the Texas Family Leadership Council, if you're going to be in Austin and you just want to do a day, maybe with Jason or Mandy, and just visit a couple of your legislators that are in your area or that have an interest in what you have an interest in, let Jason and Mandy know, and we'll do that. We love taking people around, provided that all the schedules match. And it's something that more nonprofit leaders need to be doing in our state, is visiting with legislators. And the thing that I always remember, though, Mandy, the first time I went with Mandy, who was an old pro by the time I started with Mandy, I just thought these legislators are really nice. They really like our issues. And they're nice to everyone. Doesn't mean that they're going to do anything about it. So it's a good little caveat, a little bit of information to know before you go. Jason, what would be your final words as closing remarks for this big day? What would you give as your final words?
Number one, just remember, you don't need to start from scratch here. There are a lot of specific bills that have already been discussed today. There's a lot moving, and there are a lot of bills that you can get involved in. It's that we're not at the point where you get involved in in generalities. We are now at the point where there will become bill numbers in a week. So know that. And I think that when we're talking about the Family Leadership Council, I know there's going to be a lot of energy there around, schools applying the school safety parameters to childcare centers and whatnot. So I think that there are so many opportunities to plug in through a lot of different avenues here. And I encourage folks to remember, there's no wrong way to do this. All of your organizations might be coming at this from kind of a different place in terms of what you're willing to do from an advocacy perspective. There is no wrong way to do it. There's only your way to do it. So don't be intimidated by it. It's a process that's actually quite friendly, and it is fun. It just is.
And I'll finish with, and Mandy, I'll speak for you as well, if that's okay. It's just that everyone needs to be engaged. This is so important. It's so much easier when we're all engaged together on this. It's so important for the children of Texas, for the families of Texas. again, this is the future of America right here that we're talking about. It's certainly the future of Texas, but when 10% of all the kids in America are coming from Texas, this is important. So thank you guys very much for being with us, and do the little survey. Let us know how we did. Please make sure you rate Mandy super highly. She really loves that. So that's really good. And Mandy, Jason, thank you so very much. Thanks to all, Lindsay, Lauren, everyone, Becky, who's been a big part of getting this going. Thank you guys so very much. Take care, guys.